Hi everyone, welcome back to my YouTube channel, and today we are going to talk about acute apical periodontitis. So let's start our topic with introduction. Acute apical periodontitis is an inflammatory condition of periapical tissue that occurs in response to irritation from the pulp, usually following pulpitis or pulp necrosis. It is characterized by painful inflammation that is localized around the root apex, and it represents the body's immediate response to bacterial toxins, trauma, or chemical irritants. Prompt diagnosis and management are essential to prevent progression to abscess formation or chronic periapical disease. Definition: acute apical periodontitis is defined as a sudden inflammation of periapical tissue, usually resulting from pulp irritation or necrosis, marked by severe pain, tenderness to percussion, and localized periapical inflammation. Etiology of acute apical periodontitis. Acute apical periodontitis results from factors that irritate periapical tissues. First etiology is pulpal infection, as bacterial invasion from necrotic or irreversibly inflamed pulp can cause the release of bacterial toxin and inflammatory mediator into periapical tissue and can cause acute apical periodontitis. Second etiology is mechanical irritation, as over instrumentation during endodontic procedures can cause, and also trauma from occlusal forces or accidental tooth injury can cause acute apical periodontitis. Third etiology is chemical irritation, as extrusion of cytotoxic material beyond the apex, for example sodium hypochlorite and root canal sealers, can cause acute apical periodontitis. Fourth etiology is thermal injury, as excessive heat during restorative procedures that can reach the apex can cause acute apical periodontitis. Pathophysiology of acute apical periodontitis. Bacterial toxins and pulp-derived inflammatory mediators like prostaglandin and histamines reach the periapical tissue. Then there is localized vasodilation and increased vascular permeability occur that result in edema and pain at that region. Inflammatory cells then start infiltrating at the periapical region, and if this is untreated, inflammation may progress to acute apical abscess or chronic periapical periodontitis. Clinical features of acute apical periodontitis. First is pain. That characteristics include severe throbbing or stabbing pain that is localized to affected tooth. Pain in this case is often spontaneous or aggravated by biting, pressure, or temperature changes. This pain may radiate to the jaw, ear, or head. Second, we can do clinical examination that shows tenderness on vertical or lateral percussion in case of acute apical periodontitis, and there is slight tooth mobility that may present due to ligament inflammation. No significant swelling initially is present, but it may develop if abscess forms. Other signs of acute apical periodontitis include soft tissue that may appear normal initially, and regional lymph nodes may be tender in severe cases of acute apical periodontitis. Radiographic features. In early stages, radiograph may appear normal as bone changes lag behind clinical symptoms. In advanced or long-stated cases, there is widened periodontal ligament space at the apex, no radiolucency initially is present, and periapical radiolucency develops only after chronicity sets in. Histological features. Acute inflammatory infiltrate composed mainly of neutrophils. Hyperemia and edema in periapical ligament is there. There is early bone resorption that may occur at the apex. There are fibroblasts that may be activated for tissue repair in resolving stages. Differential diagnosis of acute apical periodontitis. First differential diagnosis is chronic apical periodontitis that is usually asymptomatic with radiographic periapical lesion. Second is periodontal disease, that is pain that in this case is often diffuse and associated with gum inflammation. Third is periapical abscess, that is swelling, pus, and systemic symptoms that are present with it. Fourth is cracked tooth syndrome, that is pain on biting and there is no periapical inflammation initially. Management of acute apical periodontitis. First we do is elimination of cause, that may include root canal therapy for the removal of inflamed or necrotic pulp tissue, pulp extirpation in acute cases to relieve pain and inflammation, Second, for the management of acute apical periodontitis, we do pain control as the main symptom is the pain. We can give analgesics for pain relief and antibiotics only if systemic involvement or spreading infection is present. We also give sputum measures for acute apical periodontitis patient that includes occlusal adjustment if trauma is contributing factor and soft diet and patient counseling for comfort. Prognosis of acute apical periodontitis. Prognosis is excellent if treated promptly with RCT. Untreated acute apical periodontitis may progress to acute apical abscess, chronic periapical periodontitis, or systemic infections. Early intervention preserves both tooth vitality if pulp is not completely necrotic. Clinical significance of acute apical periodontitis. Acute apical periodontitis represents an acute response of periapical tissue to pulp irritation. Recognizing symptoms early allow pain relief, infection control, and preservation of the tooth. Differentiating acute apical periodontitis from chronic to irreversible condition guides appropriate endodontic therapy. Conclusion of this lecture video. Acute apical periodontitis is a painful inflammatory condition at the root apex that is caused by pulpal infection, trauma, or chemical irritation. Diagnosis relies on clinical examination, percussion test, and pulp vitality testing, while radiographs may lag in early stages. Prompt endodontic treatment and pain management ensure rapid recovery and prevent progression to abscess or chronic periapical lesion. And this is all about acute apical periodontitis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.